Recording is in progress now. Welcome to another Community Issues Forum for Christ Church Cathedral. We're still doing them by Zoom. By the new year, maybe we'll be doing a combination of Zoom and back at the cathedral. And we're still involved very much in the issues that face us as voters this fall.
Jim Tinker, who is our communications director, and he's back up and running the PowerPoint for us. So again, thank you. We're going to start with mission and funding around children's services. So next slide, Jim. And I want to start with, I'm hoping it's a little bit of a longer slide than the previous one, but I'll go through it quickly and so that we can get to questions or comments following. So I just wanted to provide an overview of children's services so that you'd have a good understanding of what we do, but also a good understanding of what our ask is. So Children's Services mission is safety, permanency, and well-being for children in Hamilton County, and that's a federal mission that's enacted via states, and every state has child welfare systems. Children's services programs in Ohio are largely funded in Hamilton County through our local levies. Although there is federal and state funding, we very much rely on levy dollars to support our children and families in Hamilton County. We are here asking for a renewal of levies. We have 2 current levies that expire at the end of 2021. We had a flat levy for over 20 years in Hamilton County. We asked the voters to pass an additional add-on levy in 2018 as the result of the opioid epidemic, in which we saw a dramatic increase of children coming into care. Because of the opioid epidemic, we were experiencing great staffing shortages, and we're facing really budget shortfalls. So the 2018 levy add-on allowed us to stabilize our budget. Children's Services mandated service and practice philosophy. So what are we required to do? We are required to receive reports of abuse, neglect, or dependency 24 hours a day. So in Hamilton County, that is operated through our 2-for-1 Kids hotline staff. So that's well known to the community. The hotline is, again, it's a call center that operates 24 hours a day, 7 days a week. We also have staffing resources available 24 hours a day, 7 days a week, all year long, to respond to reports of abuse and neglect in the community. So we also are required to assess allegations of abuse, neglect, and dependency in person with children and families. And our caseworkers continued to provide those services throughout the pandemic. So went into the community, met with children and families to make sure that children were safe, families were supported. We also are required to prevent removal of children from their home. It's very traumatic to remove children from their families, and regardless of the circumstances. So we're very cautious and very careful to do everything we can to prevent removal. However, when a child is unsafe, we also are required to take action. And so typically that action involves seeking intervention through the court system, and when necessary, placing children temporarily with kin or foster care families. We are required to make reasonable efforts for permanency for children. So child welfare intervention should not be forever. And there are some statutory limitations around seeking permanency for children, either to return them safely home with parents, permanently with kin, or within foster families. Finally, we are required to prepare older teens for independent living services. So that means providing life skills support and transitional support for children who are older and in care. Practice philosophy, in Hamilton County, we use an array of services and supports to support families. Custody and removal decisions are made with the input of many. The court is the only entity that can legally intervene. So they're the final decision maker about whether a child comes into care, but that's done with input from our agency, with prosecutor's office, with CASAs, guardian ad litems, and an array of professionals and community partners that we work with. While children are in care, we use what we call the least restrictive setting. So children, if children need removed, we want them in family settings. And the best suited family setting for a child is really with their kin. And with kin, we mean close relatives, close friends of the family. Kin is used broadly in Ohio. It can be a teacher, it can be a mentor, it can be a basketball coach, it can be anyone that has a close relationship to that child and that family. Place children locally. So we always want to keep children connected with their community. If they need to be out of their home, we want them to be able to remain in their own school. We want them to be connected to their friends, to their recreational activities, to their culture and their family and their kin. And if a child is removed, then we must continue reunification efforts after removal. So targeted interventions, resources, and supports for families to help them increase their protective capacities and better able to safely parent their children at home. We also use an array of services. So we partner with a lot of community entities. The most common services that we use are, we have a collaboration with YWCA around intimate partner violence, domestic violence, parenting enrichment services for families, an array of substance use treatment programs, including partnerships with agencies like First Step Home that can provide family treatment for families so that children can remain with their parents while they receive substance use treatment, intensive in-home services, targeted for families birth to 3, also targeted for families who might be having parent-child conflict, difficulties in their household, and need extra support around behavioral health needs with their children or within the family system. We also provide an array of safety net services. So, financial support, resources, short-term housing assistance, things like that will help families. And for our youth, we use programs that we have an array of educational support programs that help children through achieve success in education. We have mentors for older youth children and have an array of life skills training programs for those youth, to name some of many, but those are the most common. So I'm just going to talk a little bit about the numbers in Hamilton counties. So Jim, go back. Thank you. Sorry. So this first line is calls to 241 Kids, and that's the total calls made to that phone number, 241 Kids, to the hotline. And you also see with these numbers, you'll see the definite impact of COVID-19 and how it impacted our numbers. And so in 2019, we had 54,000 plus calls. In 2020, we had around 48,000. And those calls are not only calls of abuse or neglect, but they're 241 Kids is used as the central contact number for children's services in Hamilton County. So many of those calls are just questions, or I need to talk with a caseworker, or I need connected to some department in children's services. So I explain that because when you look at new reports of abuse or neglect investigated, those numbers are a lot lower, and that's the reason. So by new reports of abuse or neglect, we're talking about reports that are actually screened in or accepted for an assessment or investigation of that family. So in 2019, we saw about 7,400. In 2020, we dropped to about 6,800. Total children served in 2019 over 18,000, 2020 is about 17,500. And families that received assistance, there wasn't that much of a discrepancy. So around 8,500 children in 2019, 8,250 in 2020. And Children's Services helps roughly 1 in 10 children in Hamilton County each year. And when we say that, that might be, you know, supportive services, or an assessment that doesn't result in an ongoing case, but that's how many children are touched in Hamilton County. I think the other thing to note about the screened-in reports is we consistently screen about 60% of all calls that are related to abuse and neglect in the county. And I think I had, Jim, you can go on to the next slide. I had some data around. What I would say is it's also important to note that the vast majority of families that receive an assessment are closed. So we only transfer about 24% of cases to what we call ongoing services. So meaning the family needs some intervention from a child welfare agency. So JFS at a glance. So this is youth in custody. And I will explain this grid a little bit because there's a lot of lines and graphs. So the gray bars are the total youth who are in care or in our custody. And the yellow is a quarterly report of how many youth are entering care, so newly entering care. And the blue line is the total intake reports. And so what that would be is the total number of calls we got reporting that the reporter was concerned about abuse or neglect with that child. The orange grid is the percentage, indicates how many of those we actually screened in. And you can see it's a nice visual of, you see that, you know, we were pretty steady, had an increase in calls going in from 2019 to 2020. And you can see that dramatic dip in the numbers that really correlated with the shutdown, the COVID-19 shutdown that started in March. We saw about a 40% reduction of calls. When the community shut down, we began to rebound as the community opened up. The other thing to note about this grid is in terms of the custody numbers, we've since 2018, we've really worked hard to find permanency for children in care, keep children at home. And in 2018, a lot of our levy dollars went to more supportive services. So funding kinship stipends for families who took children in. It's also important to know that until recently, foster families received a stipend for providing care to children. Kinship caregivers were eligible for some public assistance dollars that were, but really weren't compensated in the same way as foster families. So Hamilton County was the first county in Ohio to provide a kinship stipend to equalize the support and resources to kinship families to make it more equal to what foster families were receiving. So we also invested in nursing staff to help us with our caseworkers and our families. So we have on-site nursing staff that respond to reports with us to give us a better assessment of the child and family's needs and to help us in decision-making around children's care and well-being. We also provided an array of added additional substance use treatments, programs, and other in-home services that have had an impact on decreasing numbers of children in care. So next couple slides, I'm going to speak about a couple of the challenges we're currently facing. One is obviously something we've all faced, the impact from COVID-19. And what we have seen with COVID-19 is children are experiencing distress, disruptions in school, disruptions in routine, social isolation. We're seeing more household stressors and general fears and worries. And so we know that as a child welfare agency, we must enhance services and supports to address educational deficits, behavioral health needs, and the overall health and wellness of our children and our families. The negative impacts of COVID-19 are disproportionately experienced by low-income families, minority populations, and children in foster care. And what is unknown to us really is what the long-term impacts will be. We expect and can try to predict what those are, and are trying to be proactive in our approaches to address those supports for children and families. Excuse me. So other community challenges that have been longer standing in terms of the child welfare population. So you have poverty, racial and economic disparity, the opioid epidemic crisis, substance use, domestic violence, and untreated mental illness. So there are, in 2020, about 55% of families we serve have substance abuse, domestic violence, mental illness as reasons of removal. And at times those concerns with families are overlapping. And so what we see are higher needs in our community, resulting in increased demand for services, more complex cases, staff turnover, and high costs of care. And just to touch a little more on the poverty impact and the correlation to the child protection system, according to the 2019 census figures, nearly 15% of Hamilton County residents live in poverty. In Cincinnati, 26% of residents live below the poverty line, including 40% of the city's children. And poverty is a known stressor that can lead to increased instances of abuse and neglect. There's been a recent study published by the Academy of Pediatrics, which shows increase in income inequality associated with increased rates of child maltreatment, and at the county level, greatest in communities with highest child population rates or high poverty rates. Sorry about that. Continuing with challenges, which are more internal facing challenges for us. Currently, we're having a great instability and turnover rate in our assessment work areas. And those are the caseworkers who are initially respond to reports of child maltreatment, disproportionality of children of color in care, high placement costs, increased case complexity of family needs, and unknowns to new federal legislation called Family First. So the grid at the right illustrates a bar. The first bar indicates what our current caseloads are for caseworkers. They're currently actually over 30 plus. This chart is a little bit old. So, and the recommended caseload for children's services workers by the Council of Accreditation is 12. So we're well over that. And obviously high caseloads really mean less time and fewer resources available for the families that we serve. It tends to drive high workloads, heavy stress, and turnover. Additionally, more recently, we have a current workforce shortage. So we really are just not getting sufficient applications for staff, which is happening nationally, but it's really greatly impacting us. So what we've been doing about that is really we've more recently been able to implement a wage increase for targeted positions, such as those front door positions. We've provided in the last couple of years secondary trauma support for our staff who do experience high levels of secondary trauma in their work, enhanced training, support, and coaching, more flexible work options for our staff. Just to touch on disproportionality, this is a national challenge. There's an overrepresentation of children of color in care, and there are disparate outcomes for children and families involved in the child welfare system. And so for us, since around 2017-18, we've instituted required trauma and implicit bias training for all of our staff who work with children and families, or all staff in children's services. Organizationally, we've embarked and engaged in diversity, equity, and inclusion work. We are also engaged in work at the state level and with the major metros. So the larger counties are engaged in work to really try to impact those numbers, and think through ways that we can better support those families outside the child welfare system. Family First, again, is just federal legislation that's just passed October 1. So there's a lot of unknowns about that. It is really pretty massive legislative change in child welfare that really significantly shifts resources, focused on emphasizing prevention, keeping children in family settings. So we have that on here because we really don't know the impact. We're awaiting guidance from the federal government and our state around how to implement this and funding around this. And it's just an unknown to us at this time in terms of the financial impact. So this grid speaks in more detail about what we're seeing in custody placement costs.
Margie, I don't want to interrupt you, but we've got to save some time for issue 3. And so if you could make some final major points of why this levy is needed.
Okay.
Great.
Okay. So that grid just really shows that we've seen an increase of children coming into care, which has resulted in increased placement costs. And that was getting into our last slide anyway. So the Children's Services Levy, this is a renewal. This is combining 2 levies that we have on the ballot into one. So it will not increase taxes. It's a 4.75 mil, cost the owner of a $100,000 home about $109 a year. It accounts for about 72% of the $107 million spent annually on child welfare. It also enables us to maximize use of state and federal funds. So it allows us to bring those dollars down through matching funds, which are required. It supports the interconnected system of public and private agencies that support and protect children in Hamilton County. It funds private and public child serving agencies, so all those community partners that provide services and resources to our children and families. It pays for mandated services, so some of what I talked about must happen, whether it's funded or not. So Jim, go ahead to the last slide. So we've already talked a little bit about where we have used the dollar since 2018. So I will just end by giving some information about what we will do if this levy continues. So obviously looking at addressing ongoing staffing crisis, funding new programs and interventions for families in our community, targeting high-risk populations, including older youth and families experiencing homelessness, increasing availability of local partnerships and preventative services to families first, and really focusing on families who, before they get to the child welfare system, and helping families before it gets to the point where our intervention is necessary, helping keep families and children receive services locally. So boosting supports to kinship families and foster families so children can grow up in Hamilton County. Helping support the Family First Act and ensuring that we are able to provide ongoing services to families impacted by the pandemic.
Well, great. You really gave a thorough analysis of what's going on here. Will you be able to stick around? Because maybe we better save final questions to the end so we can get on with issue 2.